Hello friends, welcome to BMH Learning. This video is about Triglyceride Level Test. What is the triglyceride test? It's a blood test that helps to measure the amount of triglycerides in your blood. The test is also called as triacylglycerol test. Triglycerides are a type of fat, or you can say lipid, found in blood. The body stores calories that it doesn't use right away as triglycerides. These stored triglycerides circulate in the blood to provide energy when it's needed. If you consume more calories than your body needs, you may have high triglyceride level. Now there are proteins called very low density lipoproteins, which are tasked to carry triglycerides through your blood. Measurements of VLDLs can be helpful information to have if your doctor is concerned about ways to lower your triglyceride level. Now, why do you need triglyceride level test? The triglyceride level test will help your doctor in many ways, like to determine if there is a risk of developing heart disease, for estimation of the level of LDL cholesterol in your blood. The test can also reveal the information about inflammation in your pancreas and if you are at risk of developing atherosclerosis. The condition of atherosclerosis occurs when there is buildup of fat inside your arteries. It can increase your risk of having a heart attack or stroke. So this is why you should have a lipid profile done every 5 years as part of your regular medical exam. The lipid profile tests your levels of the following: cholesterol, high density lipoprotein, low density lipoproteins, triglycerides. Now, in cases when you are receiving treatment for a high triglyceride level, your doctor will order this test more frequently in order to monitor the effectiveness of your treatment. And in cases when you have prediabetes or diabetes, it becomes necessary to check your triglyceride level regularly, because triglycerides is going to increase when you will not properly maintain your blood sugar levels. Children may also need this test if they are at an increased risk of developing heart disease. This includes children who are overweight or who have a family history of heart disease, diabetes, or you can say high blood pressure. How should you prepare for the triglyceride test? You should fast for around 9 to 14 hours prior to the test and drink only water during that period. Your doctor will specify for how much exact time you should fast before the test. You should also avoid alcohol for 24 hours before the test. Apart from this, your doctor may also inform you to stop taking certain medicines before the test. So it's very important that you should tell your doctor about the medications you are taking. Now, there are certain medications that can affect the test result. This is the list of the medications. You can have a look. Now let's know, what do the test results mean? A normal fasting level is 150 milligrams per deciliter. A borderline high level is 150 to 199 milligram per deciliter. A high level is considered when the range is 200 to 499 milligram per deciliter. A very high level is considered when the value is more than 500 milligram per deciliter. Now, the fasting levels normally vary, or you can say changes from day to day. Basically, triglycerides vary dramatically when you have a meal and can be 5 to 10 times higher than fasting levels. You have a risk of developing pancreatitis if your fasting triglyceride levels are above 1000 mg per deciliter. So the suggestion is, if your triglyceride levels are above 1000 mg per deciliter, you should start immediate treatment to lower triglycerides. Now, if your triglyceride levels are high, your cholesterol may also be high. This condition is known as hyperlipidemia. There are many reasons why your triglyceride level may be high. Some of these are due to lifestyle habits that increase triglyceride levels. These include smoking, having an inactive lifestyle, being overweight, increasing alcohol consumption, eating a diet low in protein and high in carbohydrates. Other than these, there are also certain medical conditions that can cause high triglyceride levels. These include cirrhosis, diabetes, genetic factors, hyperlipidemia, hypothyroidism, nephrotic syndrome, pancreatitis. A low triglyceride level may be due to a low-fat diet, hyperthyroidism, malabsorption syndrome, malnutrition. This was all. Thanks for watching.